I had a lot of pelvic pain throughout my cycle. It wasn't just during my menstrual cycle. And so one day I started poking around in my belly, and it was really painful, really painful. And so I was persistent, though. I didn't back off. I didn't give up. And I just kept going deeper and deeper. And what I found was that the deeper that I went, I was addressing my uterus and ovaries, but I was also addressing all of the surrounding structures. And I knew that there was still adhesions there, endometrial adhesions in there causing problems. I just kept going and going, and my pain was going away.
Wow.
Yes, it was crazy. And then I found like the next cycle that my menses was about to start, I didn't have any cramping, like none, where I used to be a level 8 to 10 the first day of my cycle.
Wow.
I had nothing. I used to get pain down the front of my legs. None of that was there either.
Wow.
And my periods were just starting. Like there was nothing signifying the time leading up to them.
Wow.
They were just starting, which was very unusual for me. So I knew I was onto something. And that's when I created the Mercier Therapy sequence.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
And Julie.
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
And Julie.
and we're coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. But we know that exercise is not the only piece of the puzzle, and that is why we are bringing you a phenomenal guest today, none other than Dr. Jennifer Mercier. Dr. Jennifer Mercier is a midwife and naturopathic doctor. She has a passion for serving women with fertility issues, pelvic pain, general wellness matters, holistic breast care, and newborn infant craniosacral balancing. Dr. Mercier owns her practice, Expect a Miracle, in St. Charles, Illinois, where she works with patients. She is the developer of the Mercier Therapy, which is a deep pelvic organ visceral manipulation modality. She also instructs other professionals on the Mercier Therapy with Mercier Therapy Professional Training. Dr. Mercier, thank you so much for joining us and welcome to our show.
Thanks, guys. Thanks for having me.
Absolutely. So tell us more about like how you got into being a midwife, how you got into medicine, and kind of your whole educational journey to get to where you are now.
Yeah, so back in my early training days, like in my undergrad, I worked for the Center for Human Reproduction, which was a large reproductive endocrinology practice right here in Illinois. I worked at the Huffman Estates location, but went downtown to Chicago every week for the IVF meeting. And during my time there, I was very young. I worked there from the time that I was 19 to 20. So only a year, but I was trained as a clinician. And as a clinician, my duties included blood drawing and pelvic ultrasound exams, as well as semen analysis, IUIs, so intrauterine inseminations, as well as assisting with hysterosalpingograms, which is a dye-injected X-ray to take a look to see if those fallopian tubes are open.
Okay.
Also monitoring IVF cycles from start to finish, meaning going into egg retrievals and embryo transfers. And it taught me a lot. It taught me a lot about how that system is a bit flawed for women. I saw women do things to do more cycles after they had failed IVF cycles, such as sell their car or second mortgage their house, and just to do another IVF cycle, but just to fail again and again. And it was heartbreaking.
Sure.
While, IVF is wonderful for the women that truly medically need it, I think it's being widely overused at this point. And so that was my early training, and it was really valuable for me, and I'm grateful for it. I met many physicians that were just super smart and taught me so much about moving forward. So I was preparing undergrad to go to medical school. I decided my last year of college that I wanted to go to the Chicago School of Massage Therapy and do their diploma program, which I did. And I graduated with my undergrad degree and that diploma in massage therapy at the same time.
Awesome.
Yeah. It was an amazing program. In my last part of the program, we were able to take an elective called Bodywork for the Childbearing Year. So it was prenatal, prenatal therapy. And I learned about doulas and midwives. I thought, oh, that's definitely something that I want to learn more about. And so I went on to learn about a couple of doula programs. DONA, Doulas of North America, and ALICE, the Association of Labor Assistants and Childbirth Educators. I got certified with both of them. And I set out to be a doula, and I worked as a doula all the while taking the MCAT to go to medical school.
Wow.
I never did take the MCAT.
Okay.
I did get accepted to medical school. It was a foreign medical school in the Caribbean, and I decided not to do that either.
Okay.
Instead, I decided I wanted to go to midwifery training, which I did. I learned from several amazing, famous midwives here in the U.S. That took me to the Miami Beach Maternity Center, where I studied with Sherry Daniels, a midwife there. And then I had been to the Casa de Nacimiento Birth Center in El Paso, Texas. I also did a lot of studying in Jamaica at the Victoria Jubilee Hospital in Kingston. Wow. So I've been all over, and I've had the fortunate experiences of learning from great midwives, but also meeting amazing people along the way.
That's awesome.
And that took me to naturopathy once I came back to the States. And I studied at this beautiful little naturopathic school that I loved so much. And I did a dual ND PhD program.
Oh.
So that's the extent of my education, although I'm learning every single day and I'm just loving life and loving serving women. But that's where I am right now. Yeah.
When you first started and you were working with the IVF clinic, was that it?
Yeah.
Yeah. What were you intending to do with that experience? Were you always interested in fertility, and did you want to be an OB? That's what my brain is going to.
Yeah.
What was your intention?
It's a great question. I actually had set out, yes, I wanted to go to med school and do an OBGYN residency and then a fellowship in reproductive endocrinology and fertility. And it was wonderful that I got the job with the Center for Human Reproduction, and that was only by the grace of knowing an OBGYN who had a partnership with that clinic at the time, and he was able to get me the job there.
Wow.
And so I don't know of any 19-year-old that gets to, do pap smears and endometrial biopsies and intrauterine inseminations just, via training. Sure. It was incredible experience.
That's awesome.
Yeah.
Very neat. So tell us about your practice now. You said, the thing that you really enjoy now is serving women. So does your practice focus exclusively on women? And what's the goal of your practice? And what are you doing within your practice?
Yeah. My practice now is primarily woman focused, but I do take care of men as well. If there's like a male factor fertility challenge that I can help with, I'm happy to do so. Most times male factor fertility needs a urologist to step in and consult with as well. And I love working with all professionals. I like to play nice in the sandbox and collaborate with everybody because we're all here on a common mission, and that's to serve people and to give them the best optimized outcome for whatever they're trying to achieve. So yeah, I have the Shared Journey Fertility Program. I also do newborn and infant craniosacral therapy for babies that have maybe some issues with sleep and nursing.
Interesting.
Yeah, but primarily pelvic pain and fertility are my two most featured, I guess, services, you could say. That's what I do the most. So women with pelvic pain, whether it be from a past sexual trauma or from a past surgery, even painful menstrual cycles or pregnancy loss, and then as well fertility. So I can help prepare women for medically assisted cycles, or we can just help women to understand better what their own body is capable of by helping them to monitor their own cycles.
Sure.
Yeah.
That's amazing. So if you're focusing mostly on women with pelvic pain and fertility issues,
yes,
that would be called. So what are you doing to help them? If you're not doing the traditional IVF medical route, what are you doing?
Sure. So it's called Mercier Therapy. I developed it back in 2006. It actually was born out of necessity for my own stage 4 endometriosis. I'd had 3 pelvic surgeries and lots of pain. And the only options from the medical community was to use a drug called Lupron to suppress my cycles.
So what is, sorry to interrupt, but before you go further, what is endometriosis? So we can kind of get a context of everything.
Sure. Endometriosis is a retrograde of menstruation, meaning when a woman bleeds out of her uterus every cycle, some of those cells actually retrograde upward and out of the uterine horns and tubes into the pelvic peritoneum and the gastrointestinal peritoneum. In studies, actually, endometriosis cells have been found up into the brain tissue and in the nasal passages.
Whoa.
So it's like leaching out of the uterus.
It is.
Whoa.
Wow.
It is. And when a woman bleeds, those cells, they weep fluid inside of wherever they are, causing adhesions and pain. And it's really an intense disease. Wow. Endometriosis is nothing to bat an eye at. It's really intense. So if I have stage 4 right out of the gate with my first laparoscope, which is the only way to diagnose it, they go in through your belly button with a scope to look at your organs. And and so if you're diagnosed right then and there, they stage it, or they used to stage it. Now there's a new staging system, but at the time when I was 26, I was staged at a 4, which is the highest.
Wow.
So
you must have had some significant discomfort with this.
Significant. I mean, and the answer back then, guys, was to be on the birth control pill.
Wow.
And I had some horrible side effects from being on the birth control pill, like uncontrolled headaches. And
so your only option had awful side effects.
Yeah. Or Lupron post-surgically. Lupron is a drug to put your body into a temporary state of menopause.
Oh, geez.
And so when you shut somebody off like that and they're a younger person, you're depleting all of their estradiol. So what does that do? Because that's a sex steroid hormone that gives us the essence of being woman. It makes us feel like we have the flu progressively, like getting worse and worse and worse. Wow. Our joints ache. We get irritable, anxiety, depression set in. We have headaches and lots of breast tenderness. And it's just, in my opinion, in my humble non-medical doctor opinion, I don't think it's the solution, because once you stop the Lupron and you take somebody out of that temporary state of menopause, who knows if they're going to actually come back into their cycle.
Sure.
Yeah.
I mean, it's like let's cross our fingers and hope that they are able to start menstruating again.
Right.
But it's still an option that's given today. Like women are still using Lupron post-surgically to quiet everything so they're not bleeding, so those cells are not becoming migratory again.
Wow. That's fascinating. I've always heard of like endometriosis as just like, oh, you have painful periods.
Sure.
And that's it. You know? And I didn't know that it could be really a systemic issue.
Right. And it is. It is a systemic issue. I remember getting low-grade fevers around right around the few days prior to my menses starting.
Sure.
Wow.
And it was a true whole body inflammatory process.
Wow.
Yeah.
Wow.
Yeah.
So how did having endometriosis help you create Mercier Therapy?
Yes. So I had a lot of pelvic pain throughout my cycle. It wasn't just during my menstrual cycle. And so one day I started poking around in my belly, and it was really painful, really painful. And so I was persistent, though. I didn't back off. I didn't give up. And I just kept going deeper and deeper. And what I found was that the deeper that I went, I was addressing my uterus and ovaries, but I was also addressing all of the surrounding structures. And I knew that there was still adhesions there, endometrial adhesions in there causing problems. I just kept going and going, and my pain was going away.
Wow.
Yes, it was crazy. Wow. And then I found like the next cycle that my menses was about to start, I didn't have any cramping, like none, where I used to be a level 8 to 10 the first day of my cycle.
Wow.
I had nothing. I used to get pain down the front of my legs. None of that was there either.
Wow.
And my periods were just starting. Like there was nothing signifying the time leading up to them.
Wow.
They were just starting, which was very unusual for me. So I knew I was onto something. And that's when I created the Mercier Therapy sequence. over a series of trial and error on my own body and then on some friends' bodies and some patients, I came up with this special sequence of addressing the front side of the pelvis, the back side of the pelvis. And it took off from there. And then I wrote a training manual, and I'm like, I have to teach this because people need to know about this wherever their city is geographically. Women need to have the ability to have access to this.
Yeah. Absolutely.
Now, as you're poking on yourself, I mean, maybe I'm just a baby, but and also I don't have endometriosis, so I can't relate to, the experience that you had. But were you thinking like, oh, I hope this helps my endometriosis, or were you just kind of exploring and then it accidentally happened? You're like, oh my gosh, this is helping me.
Yeah, option B. I'm going to definitely go with option B.
Okay.
Yeah, I didn't really know what I was doing. I just thought, oh, okay, I'm going to do this, and something's got to help me, because certainly opiates and a heating pad are not the answer.
Sure.
Yeah.
Yeah, that's not the answer. And I knew that from the beginning, that I didn't like to take medication if I didn't absolutely need it. And I was just astounded. And I never did end up doing Lupron.
Okay.
Three laparoscopies later, I never did end up ever using Lupron. And the third surgeon that worked on me said that I was stupid.
Really?
That you were stupid?
Yeah.
Wow.
You're
Oh my
stupid for not
gosh.
using Lupron. This disease is just going to come back, and you're going to need IVF to have a baby, and
Wow.
your organs are in poor shape. And I said, listen, I will take my odds, and I will be on my way, and I will get pregnant.
Sure.
And I ended up back in his office 5 weeks pregnant, doing an ultrasound. And
Seriously?
yeah, I went back to him because
Good for
I
you.
knew him from back in my Center for Human Reproduction days, and he's a good guy. He's an excellent endometriosis surgeon. But I kind of wanted to, I'm like, okay, challenge accepted and mission accomplished.
Yeah.
Good for you.
Yeah,
Good for you.
for sure.
That's amazing.
When you're talking about, you created a sequence off of trial and error, which I love, by the way, because I feel like there's so much to be said about things that can't be really shown in like scientific research in controlled ways.
Yeah.
But you're like, well, it's reproducible.
Yeah.
And I can teach it.
Yeah.
And everyone gets the same results.
Yeah.
There's a lot of power to that. So I commend you for continuing along this. I don't know if it's an intuition or these ideas you had, because you've really created something obviously that helps a lot of women. But anyways, back to my question. With this sequencing of addressing the pelvis, you're saying from the front, from the back, what are you addressing? Is it the bone structure? Is it how the joints are articulating? Is it the muscle tissue? Is it the organ tissue? What are you looking to try to address?
Yeah, I guess you could say we touch a little bit on all of those points, but it's a deep pelvic organ visceral manipulation, as you'd explained in the beginning there. So it's not a massage modality. It's more of an older osteopathic visceral manipulation technique, but I created it.
Okay.
So I am moving pelvic organs and surrounding structures to their best optimized functioning position.
Interesting.
So everybody's anatomy is different. I mean, women can have a retroflexion or an anteversion in the position of their uterus. That just means how the uterus is placed in the pelvis. It doesn't matter to me how it's placed. It matters if it's moving or not. Movement equals life, equals blood flow, and that's what we do, is work to optimize that function.
And so when you say moving, are you talking about like the contraction and expansion? Are you talking about the like actual organ moving within the abdomen itself, the pelvic cavity? What do you mean when you say like when the organs are moving?
Sure. So all organs have to move. They have to move. So if you take a breath in, your liver rotates out medially and then comes back laterally with your exhale. All organs have to be moving to be optimally functioning. So the uterus moves during the cycle with flux of hormones and how they trend throughout a woman's cycle. So the uterus pulls up into the pelvis at the time of ovulation, and then it pushes down into the pelvis at the time of evacuation or menses. But what we're doing is making the uterus move in an anterior-posterior movement so that we can elongate the uterosacral ligaments. The uterosacral ligaments are originated at the anterior portion of the sacrum, and then they insert onto the bottom or the posterior portion of the cervix. And so if you can compress that ligament a little bit and make it shorter and longer, you're giving it the idea that it needs to be able to move. Ligaments are not muscles, right? So they're not apt to move as much as a muscle would have that ability. So yeah, we're getting in there, and we're also working trigger points in the open hip joint, and we're also working on the lower back as well, releasing that aponeurosis, that thoracolumbar aponeurosis, which is a broad, flat sheet of fascia. It looks like a diamond. If you look at a picture of muscles, you can see that diamond shape, and it looks white in the picture. But all of that needs to be released for optimal pelvic function.
Gotcha.
Yeah.
Very neat.
Yeah.
So as you're encouraging this motion in the, would we call it the pelvic cavity, or just everything in the pelvic area?
Yeah, the pelvic viscera for sure.
You're saying that, when you get movement in this area, it brings life, it brings blood flow. What happens when there's not movement there?
Yeah. So anything that isn't moving is slowly losing its life because it doesn't have optimized blood flow. Blood flow is life, right? I always use the example of the trees. If the trees didn't have a breeze come along every once and again, those leaves couldn't move against each other and create chlorophyll. That's how trees and plants live. But we also need to have movement and organs moving over and next to each other. It's like an organ massage, for lack of a better explanation.
Wow.
It all has to be moving. If there's something stagnant like your hip joint, you couldn't run your best marathon.
Yeah.
You couldn't be outside just jogging and running at your most optimal. Eventually, that unstabilized hip joint is going to affect another area in your body. And therefore, we are a tensegrity structure where all tensions and balances need to be absolutely perfect. Otherwise, we are affecting other areas of our body, and it's going to reflect somewhere on down the line. We're going to feel that pain.
Definitely.
Yeah.
Definitely. No, that's definitely something that we see a lot just with our clientele here is like, hey, when certain muscles aren't working well, other muscles have to work more. And, the listeners of our podcast have heard this ad nauseum of us talking about this, but I'm sharing that to, relate that, yeah, what you're saying definitely makes sense in that regard for sure. I'm curious, as far as the kind of the abdominal therapy work, is the Mercier therapy, that's something distinctly different from other forms of abdominal therapy? And if so, kind of like what are the different aspects as far as why would somebody seek out Mercier therapy versus other forms of abdominal therapy?
Sure. So Mercier therapy is pelvic therapy.
Okay.
So we are specifically focusing in the pelvic region. So from the umbilicus or the belly button down to the pubic bone. And it is different from others because it's my sequence. I wrote the sequence. It's specific to specific steps that we take to engage the pelvic organs. There are other modalities that are true visceral manipulations, and those are fine as well. But I do have a specific protocol as well for the visceral organs.
And so is yours focused mostly on fertility then, as opposed to other different kinds of more pelvic or abdominal therapy?
So my therapy is specific to pelvic pain and fertility.
Okay.
Yes.
Okay.
Yeah.
If you wouldn't mind, speak to the fertility aspect of it. How does the technique help promote fertility?
Okay. So really interesting how Mercier Therapy promotes healthy fertility. Typically, women's ovaries kind of turn off and they go to sleep if they haven't been used in a while, especially if they've been on a birth control pill to suppress their function, or if they're an older woman, and I was part of that crew, beyond 35 trying to get pregnant. The HPA axis, or the hypothalamus pituitary adrenal axis, kind of gets a little sluggish, and the pituitary gland, which sends the signal down to the ovaries to make estradiol, it gets a little weak. Like the pituitary gland can shout down to the ovaries, "Hey girls, wake up, make some estrogen," and they're down there snoring, and then the shout gets louder, "Make some estrogen," and they're still snoring. And so we go in there and we manipulate directly the ovaries. And that it's almost like having a house guest where that house guest is sleeping upstairs and you're downstairs putting the bacon in the pan. You're starting breakfast. And that's a smell that permeates your house. Like that's an associated smell with breakfast, I think. And your house guest still, oh, it smells great, but still goes back to sleep. Then you put the coffee on, another associated smell with breakfast. Sure. And that person smells the coffee brewing and they still go back to sleep. Well, you can't stand at the bottom of the stairs and like yell up to wake them up because they're very, very tired and they're just not hearing you. So eventually you say, okay, I'm going to go upstairs and I'm going to touch their shoulder gently. Hey, breakfast is ready. Time to get up.
Yeah.
It's the same thing. Like I like to use that example because you're doing all you can to try and initiate that person to come down and acknowledge your breakfast, but it's just not working. So that's why we have to go in and directly manipulate the ovaries to hear the pituitary gland send the signal to make estradiol. Estradiol needs to be completely intact and being made in robust amounts to make a good follicle. The follicle is the sac that holds the egg. So if we don't have enough estradiol on board and we've got something that looks like a decent sized follicle to ovulate, we may not have a quality follicle and it may not fertilize.
Okay.
But if we've got enough estradiol on board, then once the fertilization occurs, then we've got enough estrogen to make the vital organs, which is the heart and the spinal cord and the brain. But women that have a deficit of estradiol may be at a higher risk for miscarriage. And that was me. I lost 5 pregnancies.
Aw, so
they all had little flickers of heartbeats. And then they all went away. And so for my last pregnancy, I was almost 41. I had to use a little bit of follistim with a trigger of ovulation to get my little boy.
Aww.
Yeah, but I never did IVF, and I got pregnant all those times just by having my own work implemented into my own pelvis.
That's amazing.
So by the manual stimulation, we were just talking about the ovaries, that helps to produce the hormone estradiol. Is that correct?
Yes.
Am I hearing that? Because that's interesting, because I was thinking that, you know, the movement in there, which it probably does this too, was doing something like a physical manipulation. But one of the other benefits is that it helps with hormone production. Because I guess when I think about it, well, that's what the ovaries are designed to do.
Right.
And I love that because every time I feel like in our society, something's not going well, like, oh, my knee hurts. Oh, I'm struggling to get pregnant, or I keep miscarrying or something. We always immediately think that, you know, some part of my body isn't, you know, I have a medical problem or I need to go to a doctor, which is probably why IVF is going crazy. But you're saying, if I'm getting this correctly, you're saying, hey, let's just make sure things are working properly, like your organs that are already there. Let's just optimize those and see what happens. Is that what you're saying to me?
Yes, because jumping into putting a Band-Aid on a festering wound is not a good idea, right? I mean, that just makes sense.
Right.
And leaving the Band-Aid there without cleaning out the wound or putting some Neosporin on it or something to help it heal.
Right.
But what I like to use as an example is you wouldn't just sign up for the marathon and just show up the day of the marathon. You would have to do a certain amount of training to expand your lung capacity, to be able to regulate your breathing, to be able to be in your best form to show up to run the marathon with nutrition and whatever else it needs, but months before the marathon.
Right.
Well, your egg, the one that is in its little primordial state, is preparing 3 months prior to its ovulation. So you've got to be in a good place as far as not drinking too much alcohol and not eating junky food and not taking a lot of prescription medication prior to that ovulation. And when we go in and we just force it, yeah, I don't think forcing it is the best way to go, because obviously, and you can see the numbers for IVF at SART.org. That's a data collection of all of the reproductive endocrinology clinics in the United States. They show the averages of how well women do with IVF. And we're at about a 30 or less % successful IVF rate per cycle.
Wow.
Yeah, and that number drops even further to about 23% take-home baby rate.
Oh my gosh.
So there's a lot of loss in IVF too, because we're taking a process that's meant to be in vivo, so inside of the body, and we're taking it outside of the body. And we're, in essence, like allowing a human being to make our baby as opposed to our own body making our baby.
Wow.
And there are several components to that too that I'm not in agreement with, like decoupling the couple and you know, people that are already having trouble with their marriage and going into a cycle like that, or cycle after cycle, creating like all of this debt and still walking away with no baby. What good are we really doing?
Sure.
So.
Yeah, and if you're working with fertility, which you do, it's such a emotional experience, I feel like. And I mean, we just had our baby, and I remember when we decided that we wanted to have a baby, I was like, okay, can we have the baby like tomorrow, like have like the baby here, like we don't have to do anything, I don't have to be healthy, there's no like, you know, check anything, just like there's no 9 months of growing, there's no waddling, it's just the baby's here.
Yeah.
But I've always told people, like, I cannot, you know, it would be so emotionally draining to go through something like that. I mean, and you're saying the financials of it, the relationship stress, that must be a lot. And
it is.
It's really cool that you're saying, hey, well, there's something else we could try.
Yeah.
You know, let's work on how things are functioning in your pelvis.
Right.
And let's just check in on the organs, see how they're doing.
Yeah, let's not drive a thumbtack with a sledgehammer.
Right.
Yeah.
Like, don't make a huge hole.
Mm-hmm.
We just need like a little gentle manipulation. I just thought about this the other day too. I don't know what you think about it. I haven't really shared it with anybody, but you know how, like, for women, we put on a headband sometimes to keep our hair out of our face? Just having that headband on for an hour can affect our cranial bones and how, like, you can feel it almost. Like, it changes the pressure and sometimes can give you a headache.
I get a headache in 10 minutes.
Yes. So do I. And even my little girl, she's 7, and she can put on a headband and she's like, Mama, this is hurting my head. I don't really like how this feels. If you think about that very minute sort of putting a headband on your head and feeling it pretty exponentially within a short order, what do we think that all of these IVF induction meds are doing to our body over time? You know, I don't have the answers, and IVF is only 43 years old. Louise Brown is an English woman. She was the first IVF baby in England. So I don't think that IVF is yet old enough. Sure. It's a really young branch of medicine, but it's $1 billion industry.
Wow.
Sure.
Yeah. So what kind of success rate do you see with the patients that you work with that come to see you from a fertility perspective? And then I'd also be interested in the pelvic pain reduction perspective as well. But since we're on the topic of fertility right now, just a little bit of a compare contrast, you know, versus IVS. What do you typically see in your clinic?
Sure. So I did a meta-analysis over a 4-year period, and I had an 83% pregnancy success rate.
Wow.
I know. It's a big number. It's a big number. And I've had people say, yeah, right. I'm like, no, well, that's the numbers. I'm not skewing my data. I have all of it. It's just right here. Like, you know?
That's amazing.
And these are women that have previously failed multiple medical attempts. They've failed because they want to do something. And so that something is going big and bold right out of the gate. And it's like, whoa, just slow your roll a little bit.
Right.
Yeah.
You know, and usually when they pull back off of those types of cycles, they do become pregnant.
Wow.
They do become pregnant. As far as the pelvic pain aspect, I haven't done a study.
Sure.
So to be completely transparent and authentic, every single woman, I would say with the exception of just a few over the last several years, have had great pain reduction.
That's amazing.
Yeah, and they'll come in every time and again for a little maintenance therapy, and we can keep it at bay without using oral contraceptives and Lupron. Or any other kind of hormonal birth control device. We can keep endometriosis flaring so intensely and aggressively.
Wow.
Yeah.
It's really been a blessing.
Well, you have to think you work in such a great market, not only with the infertility, because so many women want to have children and many, you know, struggle with it, but also we all live in a society now where most women are on birth control from the age of 15?
Yeah.
16?
Yeah.
What kinds of things do you see with birth control? Do you feel like that is influencing how you, like women walking into your office? Like, do you feel like that birth control has had an influence on that and you're having to take them off medication, just like resetting the whole system? What are you seeing with that?
Well, I do see that probably 50% of my older gals, so over 35, have been on birth control pills or some sort of oral contraceptive or NuvaRing or something, some sort of contraceptive hormonal device for many years, like over 10 years. And then they're really having trouble like regaining their normal cycles because hormonal birth control is medicine. It's not actual hormones. It's medicine. And so we have to look at the other components that are contained within those medicines that are restricting us from getting a normal monthly cycle, which is what we're supposed to be doing. So I think to your point, it is affecting women later on down the line when they're trying to conceive. Without knowing too much more. So yeah, it is.
It's very interesting.
Yeah.
Tell us about your therapy. What is it like when patients seek you out, come to see you? What are they doing with you?
Sure. So we start with a consult. I take a full medical, gynecological, obstetric history. And then I do a pelvic organ mobility evaluation. So that's just laying on my table. And I kind of poke around the belly a little bit to see if I can feel any restrictions of movement. And then I report back what I'm feeling. And then we talk about moving forward into a regime. And the regime is no less than 6 1-hour treatment sessions. And sometimes, again, like I said, we need to add a few here and there. If a woman is still continuing to have painful periods, or if she has endometriosis and she needs some maintenance, every here and again, then we'll do that as well. But the Shared Journey Fertility Program is 6 1-hour treatment sessions followed by a specific supplement and sometimes bioidentical hormone protocol. And then I teach a woman how to monitor her cycles at home. I give them a journal and I teach them how I want them to monitor their cycles. And then they're checking in over a 1-year period. Some women want to go and have a reproductive endocrinology basic infertility evaluation, meaning some labs and some ultrasound just to see what might be going on, just to get an idea of what they're dealing with, which is fine. I work with Vios Fertility Center. I refer my ladies there, and they do an amazing job with some investigational things, and then, if necessary, more invasive fertility cycles. But really, I mean, I do the same protocol for everybody. It's always the same. I find that, yes, we are all different, but I do the same pelvic sequence for everybody. The supplements and the bioidentical hormones are going to be a little bit different and very subject specific. But yeah, it's always the same. Love it.
So when people come to see you, you're basically, knuckle deep in their pelvis.
Oh, yeah.
Is it painful?
So it can be. Yeah. For women with endometriosis, yeah. And we start slow and we go in slowly, but we work up to a place where they're able to tolerate it because we have to be intentional. We can't really back off. We'll back off because we don't want to cause somebody excruciating pain. But in the same breath, we want to be very intentional about what we're doing.
And I love that you include this, you got to follow up with me for a year.
Yeah.
Because when I hear, I don't know, everyone's perspective is different. When I hear 6 sessions, I'm like, oh, that's not that much.
Yeah.
But it's almost like that's kind of the, let's get you jump started in the right direction with 6 sessions. And then, obviously you said some people are more, some people need extra.
Yeah.
But then they're checking in with you over a year. What are they checking in about?
Yeah, they'll come in and kind of get their head screwed on straight. We talk about all things. And it's like a little therapy talk session as well. But they'll bring in the journal that I've given to them and we'll go over what they're observing at home. And we can see if there are consistencies in their cycle. And then just go over their protocol, see how they're feeling, check in with each other, let them know that I'm still there. I'm their liaison. I'm going to walk with them through this until, something amazing happens, whether it be an adoption or a pregnancy. But I have to say that most women do get pregnant. They do. And that's not smoke and mirrors. That's true. And it happened for me myself. So I fully believe in what I do and the ability to help women conceive very gently, very consciously, without using the help of outside professionals.
Yeah.
Yeah,
That's amazing. Now, Dr. Mercier, you work with women post-pregnancy as well, correct?
I do.
Okay.
Yeah, for women that have had C-sections especially, but also for women that have had traumatic birthing experiences or, just normal birthing experiences, because we need to have that healing in our pelvis post-birth because our uterus has grown to 300 times its size.
Yeah.
And pushed all of the other organs out of the way, and it's a good healing modality. And, when women are kind of feeling bluesy too, after they've had a baby, I'll have them bring the baby with them, lay the baby right next to them while I'm working. And so it creates a little cohesive bond there too. And, it's just nice. Women need to talk after they've had a baby.
Yeah.
It's really important.
Well, thinking back to I don't know if this would be appropriate, so please correct me.
Sure.
But your marathon analogy, it's almost like, okay, the marathon, like we think it ends after you have a child on the outside of your body. But think about after marathon. Then you go see your massage therapist, you go get your MAT person if you're doing that. You do all these recovery steps. And it's like what they tell us to do to recover right now is, rest and breastfeed if you can. And if you don't, that's okay too, And it's like, hold on a second. Because I remember I was getting muscle activation techniques like 35 weeks pregnant. And I was like, Charlie, my uterus is in my ribs. How is that happening? Where is everything else gone? But it's quite the shift internally. So you got to think, I'm assuming, is this therapy just helping to get things to neutralize and back to how they should be?
Yeah. Right. So things will never be back to how they should be. Or should is such an objective word. But yeah, it takes us a full 18 months to recover from having a baby.
Wow.
18 months, guys.
Long time.
They take you 6 weeks.
Yeah,
6 weeks.
6 weeks, you're back to normal.
Go
You
and
go back
work
to
out.
work. Yeah, go work out, right? Don't pay any attention to that rectus diastasis that you've got. Just go for it. Yeah, we're really doing ourselves a great disservice by that. Anyway, so yes, I think that helping to get the pelvic organs situated back into the pelvis in a optimized way is going to be better for the recovery of mom. And certainly to rest a little bit after you've had a baby, because baby's keeping you up all the time. And nursing is not bad advice, but then having the appropriate movements to incorporate back into your life so you can be moving around again and not having pain, because let's face it, almost every woman that has a baby in the hospital has an epidural. And extensive hip rotation while a woman is pushing can cause some major pain in the low back and hips. So seeing you guys for muscle activation technique is brilliant, but I can work from a different perspective, and together we can create this beautiful, harmonious scenario in the pelvis.
Definitely.
Sure.
Yeah.
So how soon after a woman gives birth are you advocating that they maybe come to see you? What would be the earliest that you would suggest that?
Yeah. So after birth, I would see a vaginal birth. I would see her 2 to 4 weeks out, only if her uterus has involuted, meaning gone back to its normal size. And then post C-section is 8 to 12 weeks.
Okay.
Yeah.
And and it's the same kind of process as far as 6 1-hour sessions?
Yes.
Okay, cool.
Yeah.
Awesome.
That's really interesting.
Yeah.
I feel like I need Mercier Therapy now.
Well, girl, you come on in anytime. We'll take care of it.
So Dr. Mercier, if one of our listeners is hearing this right now and they're thinking, you know what, I'm having a lot of discomfort, or they are struggling to get pregnant, are there things that they can do on their own in addition to coming to see you that could help with either of those two things?
Yes. And I always say, let the food be your medicine. Eat as organic as possible and just make good, healthy food choices. As far as supplements and movement are concerned, there are people like you to help with movement, appropriate movement. Because as you said, when we first met, people are going to the gym and they're not correct. They're not doing their workout correctly. And so to get good perspective on even just movement is important. I mean, movement is life, right? So yeah, I keep it very simple, and I say let the food be your medicine, because if I start implementing all the things, people are not apt to be very compliant.
It's like,
definitely.
well, let me give you a list of these 100 things. Just get them all done next week, and then come see me the following week, okay?
And eliminate gluten and dairy and just eat grass clippings.
Yeah. And sleep 12 hours a night.
Yeah,
Meditate for 2.
And get yourself to yoga 4 times a week.
That's right. I know.
No. You have to be so realistic with people, and then they're going to be very compliant with you. And if you give them just simple little things, I mean, people know what they should and shouldn't be eating. Yeah. Really. Yeah. I mean, you know, like processed foods, just no bueno. Like you cannot do that. You've got to allow the food to be your medicine.
Definitely.
Yeah.
And then if there's something that somebody should be doing before they come see you in order to prepare their body or while they're going through Mercier Therapy, what do you suggest that people do outside of your clinic to kind of help the process go more smoothly? Is there anything that you say, hey, you know, like during this time, you definitely want to be exercising, you don't want to be exercising, you know, is there additional nutritional guidance that you give in addition to the supplements and things like that?
Yeah. So for the nutritional guidance, I always say just let the food be your medicine. And I always like to point women to just plain old walking. Nice. You know, if they're not already working with a muscle activation person, professional, or they're not working with a trainer of some sort, I like to say yoga too. Yoga is really relaxing, but it's also very strengthening and lengthening. So I'm a big proponent of yoga and yin yoga at that. I'm a yin yoga teacher. Oh. And so just holding those poses, those few poses per class for 3 to 5 minutes each, you can really open up some joints and get some blood flow and mobility in the joints, and just be meditative for that 1 hour. Yeah. Also meditation. Meditation's great too, but journaling is my favorite.
Yeah, right?
Are you a journaler? You and Charlie.
Yes. Are you a journaler, Charlie?
Yes.
Right on. That's the best.
It's a very structured format for me.
Yeah.
But I do it every morning and night.
Yeah, it's great. And I say use colored pens and make little pictures and put scripture in there if you're so inclined to do so. But yeah, get in touch with yourself, because handing it over to someone else isn't going to make a bit of a difference.
Sure.
Yeah.
Sure.
It's amazing how much in what you said was, hey, let's think into your body. Let's look into your body. We find that so many times when people come here, like people start feeling better with their workouts just because we're going off of what their body is telling them, not what the workout says. So if we have to like scratch that, it's cool, because the whole goal is to get your body healthier. Just like I would assume with your work is like, hey, let's be more mindful of what's happening in your body. Let's take care of your body. Let's fuel it with good nutrition. Let's see if we can get it back to its optimal, I guess we could say.
Absolutely.
So Dr. Mercier, you've talked about kind of what our listeners can do to help improve their health, what they should be doing, things that they should be on the lookout for that might be a telltale sign that they need to come see you. But we're curious, what do you do to help promote your own health throughout the week?
Yeah, so I do attend hot yoga classes. I have to be completely honest. I haven't attended one in probably a few months because I have a low back issue that I've just kind of been nursing. But I am an avid walker, and I am out walking every day. Because my children won't let me do anything but. So I'm always moving around constantly because I have a 5 and a 7-year-old and a puppy. But but we eat very clean in our house.
Nice. Yes.
Yeah, we don't eat anything processed. My children don't. They know that how we eat, and they'll like call other people out like in their classrooms. Hey, that's not healthy for you.
That's awesome.
Yeah, they're pretty awesome. And they know exactly how it's going to go down in our house with our avocado toast and our gluten-free and all that. Yeah. So that's what we do. That's what awesome. I do. And I try to just follow very closely the advice that I would give to somebody else as well.
That's perfect.
Yeah.
We always love to hear when professionals are practicing what they preach. So kudos to you for doing that.
Thank you so much.
It's not an easy thing. And, this is something that Julie and I talk about quite a bit is, people will say, oh, you work in the gym, it must be so easy to get a workout in. And it's like, we got to schedule it just like everybody else. Like you have to be disciplined just like everybody else. And so to speak with other professionals that are, raising children and that, have a puppy and have a full blown career and a full practice and everything like that, it just goes to show you got to schedule it just like everything else. You got to prioritize it. You got to emphasize it in order to get it done. Otherwise it's so easy to kind of fall by the wayside and opt for the easier route. So kudos to you for, making it a priority in your life and for teaching your children how to make it a priority in their lives. It's a really tremendous thing.
Thank you. Yeah, you have to keep yourself on the straight and narrow and make time for yourself. For sure.
Absolutely. So how can our listeners get in contact with you? Are you on social media at all? Tell them about your website. How can people connect with you to learn more about the work that you're doing, as well as, set up a consultation?
Sure. Yeah. So we only book appointments via email now because it's gotten so busy, which is a great blessing. Yeah. So rest assured, you send us an email, you'll get an email back the same day. It's merciertherapy@gmail.com.
Love it.
And then my practice website is expectamiracle.life. And then on Instagram, which I love so much. It's been really fun to kind of know people from around the world on Insta, but it's jennifer.mercier.therapy.
Awesome.
Yeah.
And we'll put those in the show notes
Thanks.
if you need to figure out how to spell Dr. Mercier's last name.
Thank you.
Absolutely. So, Dr. Mercier, the question that we like wrapping up with for all of our guests is, what is your definition of health?
My definition of health is all encompassing as far as like the nutritional aspect and keeping it clean and moving.
Mm-hmm. Well, moving, I mean, you spoke about that earlier, just how important it is just for our bodies, for our overall health, our organs having to move, our blood flow having to move, everything like that. And so, I mean, it makes great sense. And I love that that's your kind of guiding philosophy. And that's fantastic. You can see it coming out in your practice as well, as far as the emphasis of your practice helping people improve their health through, getting everything working better inside out from a movement perspective. So,
absolutely. Yeah.
Very neat.
Well, thank you so much for your time. We really appreciate it.
Thank you very much for having me.
Absolutely. It was our pleasure. For our listeners, who do you know that needs to hear this episode? Who do you know that needs to connect with Dr. Mercier and learn more about the work that she's doing? Share this episode with them so they can hear about the amazing work that is happening in St. Charles with Dr. Mercier. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review. It helps so much because it allows us to show up higher in search results so other people can find us, find information on exercise, find information on health, find information on Dr. Mercier, and find information on fertility, especially with podcasts. So if you wouldn't mind, leave us a 5-star rating and review. We really, really, really appreciate it. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.